Alright everybody, welcome. Today we're going to look at a specific area of kidneys, the glomerulus, and we're going to look at how the glomerulus filters and the things that are going to affect the glomerular's filtration rate, and also some recent studies on using that filtration rate to make predictions of for other body systems, and actually use those predictions to then modify behavior and make treatments. So looking at the glomerular filtration and the glomerulus itself, first of all we're going to look at the function of the glomerulus, the different things that are going to affect how that filtration works, and some recent studies and application of using that filtration rate to make predictions with other body systems, as all these body systems are connected. So let's look at the function of the glomerulus. So here it is inside the kidney, and as blood is coming in, going through these glomerulus capillaries, and in this glomerular space we're looking at filtering the blood, and mostly looking for things that it is going to filter are smaller salts and urea and so forth that are then going to go out the proximal tubule and then later be secreted as urine. So that's its primary function. Another image that is helpful is looking here. This is also looking at some of the factors that are affecting that glomerular filtration. So within that we have all these wonderful capillaries that are helping us filter out the waste within the blood. So some good facts to remember here is that at any given time 20% of the total blood volume that we're looking at is filtered each minute. The rest of the 80% is not filtered, and the things that are going to affect what is filtered, again, water is filtered, nitrogen's waste comes out, and various nutrients. Factors that are going to affect the rate at which the glomerulus filters. And the first one is hydrostatic pressure, and that hydrostatic pressure is the pressure that is put in through the blood. So the rate at which the blood is coming in is also going to affect the rate at which the glomerulus can do this filtering. Another thing right along with that hydrostatic pressure, which is related in that as well, is the amount of blood that's coming through, the blood volume that is coming through the capillaries at this time. This is also related to the blood pressure, so how much pressure is being put on, and then these wonderful arterioles and these afferent arterioles within that is also going to affect the rate at which the glomerulus can filter. So all of these things are going to combine to give us what we call the glomerular filtration rate, and that is also abbreviated as the GFR. So if hydrostatic pressure is high, then that filtration rate is going to be high. If we're looking at an increase of blood volume, that's also going to affect that. Increasing blood pressure will increase that as well. As we are constricting those arterioles, that's going to decrease the filtration rate. And the way that this is found, this is related to because blood and the filtration rate are so interrelated. We're going back and looking at the Starling law of the heart, which was discussed previously in a video. And so in order to find this is one of those things that can be looked at as a particular rate. We can actually do this with an equation. So the glomerular filtration rate is determined by the hydrostatic pressure along with the... Alright, so getting back to that equation, we're looking at the filtration rate is determined by a filtering constant, and that is multiplied by the hydrostatic pressure of the blood and any changes thereof, and then we're also looking at the osmotic pressure. So it's the filtration rate is determined by a filtration constant multiplied by the hydrostatic pressure and then subtracted from the osmotic pressure, which we can look at there. So osmotic pressure will decrease, hydrostatic pressure will increase, and then we have this constant rate of filtration that is giving us the features that we need. Now ultimately, of course, what the glomerulus does as it's filtering these nitrogenous wastes and the other smaller particles is, here we are, there's the kidney. Within the kidney we're getting these smaller pieces, so these arterioles, if they're constricted, they're having an effect. But this glomerulus is providing all the filtration that we're needing, then is going to send it through the proximal tubule, through the loop of Henle, then the distal tubule. That's going to go to the ureters, and then the bladder, and then through the urethra. But in order to make sure that this filtering process, we got to filter out the things that we are getting rid of and keep the things that we need to keep. So that's, again, the glomerulus's main function. We have several of those areas within the kidneys themselves. The amount of blood that is filtered per day is an incredible amount, and it's doing this all the time, again at 20% efficiency. So we do this multiple times per day. Now, looking at some of these interesting studies that have been done. So we're going to look at using that filtration rate to find a correlation with other body systems. So the first thing we're going to look at is using the glomerular filtration rate as a comparator for left ventricular mass. And the study that was done here was done to look at people that had chronic kidney disease, and in this chronic kidney disease, there was an excess amount of protein in the blood, and then of course that then goes into the urine because there's only so much that can be filtered, and those protein molecules, if there's an excess amount, sooner or later we have much that is being absorbed, and there's only some of it has to be passed on through there. So what they found was, looking at this filtration rate, they could, along with high blood pressure as well, they could predict the formation of left ventricular mass, which is going to cause issues with the heart. So looking at this rate could give them ways to not only find this correlation, but then have a chance of treating both conditions so that they could extend the life of the patient. Another thing that they looked at was looking at a correlation between the filtration rate as well as making a prediction of, using that filtration rate, making a prediction in coronary heart disease risk in patients with type 2 diabetes. So looking at this particular thing, we were already dealing with one particular issue in a diabetic, but now as the person is dealing with being diabetic, we're also then giving the prediction as to what needs to happen and what we need to do. Looking at that filtration rate, we can also make a prediction of the person's risk for getting heart disease, and then making that prediction and recommendations on further treatment for both of these conditions, because as we've seen before, these two are very well interrelated, and they're going to be intertwined as far as what's going to happen if one affects the other. So if the kidneys, again, are the filtration unit for the blood, if the blood is not being filtered or pumped through correctly, that also affects the rate at which the filtration of the waste is going to happen, and that in turn, they're going to cause problems for each other. These systems are intertwined, and any changes made in one area are going to cause changes in another. So looking at the correlations then helps us treat patients in a more efficient and effective manner, and provide more unique treatments for each patient, because one treatment may work for one person but may not work for another person. Fascinating things to ponder and to think of, as we see that even small things can have big effects. These smaller filtration units and the rate at which filtration happens can in fact affect the heart and the blood. So there we go, looking at how that filtration rate is affected. Here's our references with that, how we look at how this works and how high blood pressure and all these things affect the rate at which this filtration happens. Here's some of that basic stuff that we look at for giving credit where credit is due, and the way that kidneys function. So interesting things to discover, again, just on a small scale, how those can have large scale connotations and effects. Thank you for joining me again today, and see you again next time.